If you want to maximise your performance on the bike, or you want to optimise your bike setup, today we're talking bike fits at Grandstand. All right. You ready? You pumped? Yeah. G'day guys and girls, it's Anthony from Grandstand Sports Clinic. Today we're talking about optimising your position on the bike to maximise your cycling performance. And we're joined by Paul, who's our resident bike fit expert. He's going to be telling us all about the process of a bike fit, what you should be looking for, and what you can expect to gain out of a good bike fit. So Paul, a lot of people will have heard about having a bike fit, but don't really understand the process of what's involved in it. What does it involve?
So basically a bike fit involves a process of looking at the cyclist. You got to look at the cyclist as a person, their joint range of motion, their strengths, their goals, what they want to do on their bike, and then you look at their bike, the constraints of their bike, its measurements, dimensions and functionality, and then you look at the two combined. How does the person ride that bike? Whether look at their setup on the bike, and then you look, does their personal characteristics match with that bike, and how can we best kind of gel the two together so that they can ride with efficiency, without pain, and with the most power they can produce for their given sport.
Okay, so it sounds like it's equally important to match the person to the bike as well as matching the bike to the person. As a physio, how would your bike fit differ from, say, another bike fit that you might get at a bike shop or something like that?
I'd say the key difference would be the screening process, and probably more the understanding of the screening process. So I think a lot of bike shops and other bike fitters, they'll run through a basic screen, but I think understanding the body, being a physio, and understanding what it means when you have a tight hamstring or a poor hip internal rotation or whatever variable it is, knowing what to do with that, and how that will influence someone on the bike. If you try and adapt the bike when someone needs actually a physio, or if you go the other way and you try and tell the person to stretch something or change something when it's not actually in their physiology. So I think the biggest benefit comes from the understanding of both. So understanding the requirements of cycling, but then also understanding the body and being able to interpret the findings when you screen someone.
And I guess it's important that you can't just set up a bike according to a formula, because every body is going to be slightly different, and unless you're really screening for those changes in joint range and the muscle strength things, and we look at some of the tests that we do in part of your screening where you're doing functional assessments, unless you're screening for all of those, it doesn't really matter how the formula applies.
Yeah, I think there's some pretty common guidelines. Like, to know how someone should look at a bike is quite straightforward, and we know, for instance, say a common one would be that we know that there should be between about 30 and 35 degree knee bend at the bottom of the pedal stroke. That's pretty easy to measure and easy to set someone up with, but knowing where in that range they should sit, or when you should put them above or below that range, or where they need to do a stretch, or where they need to change the bike, that's where the art comes in, and the formula goes out the window. And I think if you stick to a formula, we've all got very different body dimensions. Some people have long limbs, some people have short limbs, some people have long bodies, and unfortunately the formulas don't apply. And I think they could work for maybe 60% of the population, and then 40% of the population are going to actually get worse by following those formulas. So I think formulas don't often work.
So let's have a look at an example of some of the screening tests that you will do with a client during a bike fit. So we've got some vision here. So just explain some of the tests that you're going through and what sort of things are you looking for in the athlete?
So I'm just sort of looking to see if the patient or athlete has any abnormal joint range of motion. So for instance, we know that there needs to be a certain amount of low back sort of flexion to be able to sit on a bike for a prolonged period of time, and we know that the hips need to be able to move in a certain way, like with being, there's high incidence of low back pain and knee pain. We'll look a lot at hips, internal rotation, whether they've got good control of their limbs, so looking at like single leg squat, and combining those things to get a picture of the athlete and know what they might look like on the bike before they even get on the bike. And very commonly we'll do a screen, and in my head I'll have a picture of, if they're already tight on their right side or they're weak on that side, there could be a chance that knee might not be tracking great, or that hip might not be sitting square on the bike. And I'll know when I do look at the position on the bike that if there is something not sitting within those the formula ranges, that I'm not going to go and change the bike. I'm going to look, okay, well, there was an abnormality in the body. Maybe it's going to be some physio or a combination of stretches and exercises that you use to fix the bike setup, rather than just changing the bike quickly and hoping that the problem will be fixed.
And so it's very much a case of changing the body to fit the bike in that scenario. From that point of view, would you consider that the screening tests that you're doing, are you looking at opportunities to improve performance? Are you looking at opportunities to reduce the amount of injuries, or?
Both. So but generally both go together. So with the bike setup, generally if you're in a position that is less conducive to injury, it's probably a position that's going to allow you to generate the most power. So we know that there's certain ranges of motion that the joints need to be in to be able to have the most force and produce the most power, and often those are the ones where they move smoothly. So for instance, we know that if someone's hip is tight, then their glutes are inhibited, and so if we put someone in a setup where they're too far bent over and they're not able to access their glute, lifting them up is one, it's going to increase their power, but two, it's going to improve the way the knee moves probably. So it's about finding it's probably going to improve both, and depending on the athlete's goals, sometimes we'll make the setup more aggressive, but what comes with that, if they do have a restriction, we'll give them homework, we'll give them exercises that they need to do to maintain the joint range of motion to be able to ride in that position. Whereas if they're just someone who wants to be able to ride on the weekend without any pain, we're probably going to be more conservative. So we're going to fit the fit towards the patient, but also to the patient's goals.
Okay. So there's the old adage that you can be comfortable on a bike or you can be fast on a bike, but you can't be both. What do you think about that?
I think you can definitely be both, and there's a lot of evidence showing now that decreased comfort actually decreases performance. So when a cyclist is uncomfortable, they're using all their postural muscles and all their accessory muscles over time. That makes them way more inefficient. So for any sort of length of race, you'd think comfort is almost as high a priority as anything else. There are instances where, like Tour de France cyclists who are riding an 8-kilometre prologue, they might be happy to forego a little bit of comfort for a bit of aerodynamics, but with aerodynamics decreases power. So it's this balancing act of all three sometimes, but I'd say you can definitely be comfortable and powerful, and it's probably more a trade-off between comfort and aerodynamics rather than speed and comfort.
So Paul, you've obviously had a lot of experience with doing bike fits. From an injury point of view, what are the types of injuries that people come to see you about where you are really confident that changing their bike setup can make a significant change to their injuries?
The two most common cycling complaints or discomforts and injuries would be low back pain. So just being on the saddle, bending forward, complaining of low back pain with time riding, and then knee pain is also super common. In both of those, there's a lot of scope for change, and they're quite easy to change when you know what to do.
Mm-hmm.
So with the, say, low back pain, a lot of it I look at saddle tilt and making sure that their pelvis in a position that allows them to be open through their hips and their lumbar spine not under too much sort of stress. And that involves sometimes how far they're reaching out, the height of the seat, the angle of the seat. But yeah, generally with that, and then say through the assessment we notice that there's just no movement in the lumbar spine, and no matter how much we change the setup, they're going to be stiff. Then we'll give them exercises. We might treat them within session just to see if we can make short-term changes, and then send them away with some homework and some changes. And then with respect to knee pain, there's definitely often a sweet spot with when the knees are happy. So it's all to do with compression of the patella a lot of times. If it's anterior knee pain, and you just got to find that point where there's not too much load through the patella. And the other one is generally if the seat's too high, there's a lot of lateral knee pain, and that's just about finding that spot where they're not foregoing their power or their efficiency, but they're not also rocking side to side and loading up through the knees, and that'll be different for every person.
We can see in this vision, Paul, you're using an iPad as part of your bike fit. What are you using the iPad for?
I just use the iPad to take video basically, and with the app that I use, we can measure angles. We just put some landmarks on the body, and then we just measure the angles at different points of the pedal stroke. So we know that there should be within certain ranges at certain revolutions on the pedal stroke, whether it's the bottom, 90 degrees, or at the top. So we just kind of use that as a guide to make sure he's within sort of normal range, and his body's moving normally through that range.
So here we have a front view of our subject during a bike fit. Just explain to us what you're looking for in this bike fit, and what things can you see with this particular subject which may be areas of concern for you?
Okay, so yeah, with this front view here, it's normally the first view I'll look at. It gives us a really clear angle using the laser there to see if the knee's tracking in or out. Ideally it'd be a very subtle figure eight, mostly on the tibial tuberosity, just basically the knobbly bit in the front of the knee, lining up straight over the second toe. With Greg here, we can see that on his right side, his knee's just diving out a little bit, so that's problematic, and so we would be a bit worried about a bit of knee pain on that side. We can also see that his heel is a little bit turned in. So basically, sometimes the knee follows the foot. So we'd probably look at a couple of things there to see if we can optimise that knee tracking.
So now we switch to a side view, and again, Paul, just talk us through what you're looking for, what things you can identify from this particular vantage point.
Okay, so with that, I'm looking, probably the first thing I look at is the knee angle, but with the knee angle, the body is very good at preserving the knee angle. So a compensation will generally be the ankling. So if the knee angle is too great, or the seat's too high, the body will sometimes point their toe at the bottom of the pedal stroke to try and preserve the knee angle. And also sometimes you'll see a rocking in the hips. Very often the knee angle won't change until very much at the end, and I guess so that's where you've got to be looking outside that to make sure that there isn't any compensation going on in the body. Otherwise, I'm just looking at the alignment of the spine, so we want to make sure there's a gentle lumbar curve and a generally sort of gentle curve through the thoracic, and there's not too much of a kink in the neck. We're also wanting to look at the arms. They shouldn't be locked out straight or too much weight bearing through there. Should be a gentle bend in them. And the rider should just generally look relaxed. The other thing we're looking at is just the overall balance of the body on the bike. We don't want them to be too far over the front of the bike. We don't want them to be too far in the back of the bike. A lot of the evidence is showing that if the person is balanced on the bike, balanced over the bottom bracket, they're going to be more efficient and produce more power and have better handling of the bike.
So using Greg as an example here, what are the things that you can see from this view which are areas of concern for you?
We can notice here with the patient that he's toeing down at the bottom of the pedal stroke, so there's an optimal angle of how much you should be toeing down, and he's a bit outside that. That makes me think that maybe he's trying to preserve his knee angle and maybe he's slightly too high. Besides that, we can see he's a bit of a curve through his lumbar spine. It's a bit too great. I'd be a bit worried that he might be under a bit of stress through his low back. His arms are a bit locked out, and his neck doesn't look relaxed. So they're the areas that I'd be looking to change.
And at this stage here, whilst you've got him on the bike, before you look at making any corrections, how much coaching are you giving him in terms of his position?
Don't give him any coaching as far as his position, but I'm wanting to get as much feedback as possible. So the fit I like the fits to be a kind of a combined sort of thing. We got to know what the athlete's feeling in each position. So I'm constantly asking, how does that feel? What do you feel in your body? How is it different? Because we can't know how they feel, and what looks good to us may not feel good to them. A lot of people might say that you get used to a fit, but I'm a big believer in when you're in the right position, it should feel automatically good, and it's not something you try and get used to. So yeah, I'm constantly asking their feedback, how it feels, whether it feels like it's pulling anywhere, tight anywhere, and probably ask them too much, they get annoyed.
So given those things that you've noted on the bike, we're going to have a look now at you going through an assessment. So in the assessment, the physical assessment that you did with the patient, what did you find?
So we did a pretty thorough history checking first, and he noted that he's been complaining about a bit of right side low back pain and some lateral or posterior knee pain. And then we did a physical assessment on the bed. The key findings from that was a significantly reduced internal rotation in his right hip, and a bit of stiffness through his right sacroiliac joint. So they were the key things that we were looking at. Otherwise, he just had quite tight hamstrings. So taking that into account, we'd know that there's potentially on the bike, he's not going to have as good a movement through his right side. Both his hip and his sacroiliac joint weren't moving properly. And when we took a look at seat heights, because of his significantly tight hamstrings, he's always going to be at the lower range of what is normal for him, and that's probably the main take homes from his assessment.
So following on from your assessment, we then see you using this technique with the seatbelt before you get him back onto the bike. What are you trying to do here?
So I'm basically trying to determine whether his knee tracking issue is coming from a tight hip, or whether it's from potentially a cleat position or something like that. So we know that when there's a restricted hip internal rotation, sometimes the knee does have a propensity to track outwards. So I'm just loosening up his hip capsule, trying to get a little bit more hip internal rotation, so that when we do put him on the bike, we'll get a better picture understanding. It's more like a way of diagnosing whether it's the body or the bike, and so we make the right decision with changes going forward.
Okay, so given what Greg looked like on the bike and what you found in the assessment, what things did you change in order to try to improve his bike position?
So what we noticed from both was starting with the bike. He had a slightly tilted up saddle. So when we look at how the pelvis sits on the saddle, if it's slightly posteriorly tilted, that's going to hinge his hip range and going to make the lumbar spine move more and bend more, which his back doesn't do very well. So what we've done to take the pressure off that is we've slightly decreased his saddle tilt down to -2 degrees. So we've moved that 3 degrees in total. That's allowed to open up his hips and his back, and then that's allowed him to sort of lean forward on the bike without as much pressure. Besides that, we've lowered his seat by 3 millimeters. So he was a little bit too high and he was towing down at the bottom of his pelvis stroke, so we've basically decreased that height, because taking into account that he has really tight hamstrings. And then we've also loosened off his hip, but then we've found that when we've loosened off his hip, his knee tracking has improved. So we haven't touched anything in respect to that. We've just given him a set of exercises. We've given him some tools to maintain his hip range. So we'll basically give him some stretches, foam rolling, exercises through hamstrings, trying to get that knee staying good. And then we'll probably follow up on that just to make sure, check in, as a normal part of the fit is we know that people are changeable, and we want to follow up as part of the initial fit to make sure they're on the the right track.
So after all our interventions, this is what we're left with, and we're looking here at vision of the before and the after of the bike in front. So again, Paul, just explain to us what you see here and what are the big differences?
So the key differences, I'd say, would be that right side knee tracking. So he's got a smoother up and down, so he's going to put less stress through his patellofemoral joint. Besides that, from the side view, he's got a more linear curve in his lumbar spine. He's not as loaded up through his neck, and his arms are more relaxed. And then his overall centre of mass is more balanced over the bottom bracket. So yeah, they're the key changes. And there weren't huge changes as far as the corrections to the setup, but they've made a big impact on how he sits on the bike.
And I think a point that you touched on before, and then, you know, to my untrained eye, certainly looks more natural, more free on the post view than he did beforehand. It just looks like he's more comfortable and more suited to the bike after your interventions.
Yeah, I think he's probably more relaxed, and I guess if you're comfortable, more relaxed, then that generally equals more efficient, more power, and etc.
So there's the process from start to finish in a nutshell of what a bike fit involves, including some of the things that a physio will look for in the bike fit. Paul, thanks very much for sharing your time and obviously your expertise with us here. I'm sure anyone who's watched this will have a better understanding of what a bike fit involves. If you are interested in the bike fit, obviously contact Paul here at Grandstand and you'll get a huge amount of information which will only help to improve your cycling performance. If you like the video, press the like button, consider subscribing, and we'll see you in the next video.